Hi, my name is Jayla Poindexter, and I am a junior psychology major from Greenville, South Carolina, and today we will be talking about schizophrenia. A lot of what people know about schizophrenia is from what they see on TV, but that is not always the case. Today, the topics that we will be discussing are what is schizophrenia, the discovery of schizophrenia, heredity, the dopamine hypothesis, beyond the dopamine hypothesis, and brain anomalies in schizophrenia. First, what exactly is schizophrenia? Schizophrenia is a debilitating disorder characterized by perceptual, emotional, and intellectual deficits, loss of contact with reality, and the inability to function in life. It is a psychosis. The individual has severe disturbances of reality, orientation, and thinking. Schizophrenia is diagnosed in about 1% of the population worldwide. Schizophrenia afflicts men and women about equally as often. Men usually show the first symptoms during their teens or 20s, while the onset for women ordinarily comes about a decade later. This graph displaying the risk for schizophrenia by age shows that those ages 20 to 29 are at the highest risk. The term schizophrenia was coined in 1911 by the Swiss psychiatrist Eugene Buehler from the combination of two Greek words meaning split mind. The term refers to the distortion of thought and emotion which are split off from reality. The schizophrenic has some combination of several symptoms, including hallucinations, delusions, paranoia, disordered thought, inappropriate emotions or lack of emotions, and social withdrawal. It wasn't until the 1960s that increasing knowledge of neurotransmitters, brain scanning techniques, and improved genetic studies shifted the explanation for schizophrenia. Schizophrenic symptoms can either be positive or negative. Positive symptoms involve the presence or exaggeration of behaviors such as delusions, hallucinations, disorganized thinking, and abnormal motor behaviors. Negative symptoms are characterized by the absence or insufficiency of normal behaviors and include lack of emotion, inability to experience pleasure, lack of motivation, poverty of speech, and impaired attention and social interactions. Schizophrenia is a familiar disorder. Identical twins of people with schizophrenia are 3 times as likely to develop the disorder. Adopting out of a home with schizophrenia provides little or no protection from developing schizophrenia symptoms, as shown in the graph. Recent genome-wide studies have identified at least 108 genes expected of a role in producing schizophrenia. Both heredity and the environment are needed to explain the causes of schizophrenia. Some threshold of causal forces must be exceeded for the illness to occur. Environmental challenges combine with a person's genetic vulnerability to exceed that threshold. Next, the dopamine hypothesis. Researchers determined that amphetamine produces schizophrenic symptoms by increasing dopaminergic activity. The dopamine hypothesis states that schizophrenia involves excessive dopamine activity in the brain. Schizophrenic patients typically have higher dopamine activity in the striatum. The aberrant salience hypothesis suggests that heightened levels of dopamine increase attentional and motivational circuits to make ordinary environmental features seem significant. Therefore, an individual projects his or her own thoughts and imaginings as real-world events and experiences. Beyond the dopamine hypothesis. Prolonged use of anti-dopamine drugs often produces tardive dyskinesia, tremors, and involuntary movements due to long-term blocking of dopamine receptors and resultant neuron death in the basal ganglia. Since the early 1900s, we have seen the introduction of several new antipsychotic substances that are referred to as atypical or second-generation drugs. These antipsychotics block T2 receptors less strongly while also targeting non-dopamine receptors. As a result, they produce motor problems only at much higher doses, but they still reduce psychotic symptoms. Lastly, brain anomalies in schizophrenia. A signature characteristic of schizophrenia is a decrease in brain tissue, both gray and white matter, with deficits reported in at least 50 different brain areas. The top diagram, a normal brain, shows little to no gray matter loss, and the bottom diagram, a schizophrenic brain, shows significant gray matter loss. An indication of the tissue deficit seen in schizophrenia is ventricular enlargement. This is because the ventricles expand to take up space normally occupied by brain cells. People with schizophrenia have prefrontal deficiency, which can be assessed using the Wisconsin card sorting test. It requires individuals to change strategies in midstream, first sorting cards using one criterion, but then changing to another. Many people with schizophrenia perform poorly on this test, persisting with the previous sorting strategy. Normal individuals show increased activation in the prefrontal area during the test. Schizophrenic patients typically do not. That is the end of my quick lesson on schizophrenia. Thank you for watching.